Hello, my name is Terry Carter, and my presentation today is going to be Getting Back Active. It's exercises to help prevent work-related back pain in the workplace. I want to give a special thanks to my husband, Tim Carter, for helping me with this video, for it could not be done without his help, so thank you very much. All right, so Getting Back Active. This presentation is going to be taking place in an industrial park industry where my target demographics are going to be 18 to 65-year-old males and females in an industrial workplace that are going to be doing either hands-on type of activities, industrial work, or administrative work. So I have actually 5 objectives in this particular presentation. I have 3 cognitive objections. The first one, cognitive number 1, is going to be based upon completion of this program. The participants will comprehend the causes of back pain, including the examples and how to eliminate and overcome each one. The second cognitive is going to be by the end of the session, each participant will be able to recall the definitions of degeneration, regeneration, and also of the muscle groups around the spine, including all key components. The third cognitive is going to be upon completion of this session, participants will be able to analyze 8, which is all 8 of the different exercises to help prevent back pain. The next 2 objectives that I have are affective and psychomotor. The affective objective is going to be by the end of the session, the participants will show an increase in the self-efficacy about their ability to differentiate between bad back pain habits and good back habits. And our psychomotor, which will be the last 8 slides, will be to, upon completion of this session, that the participants will be able to physically demonstrate with accuracy and correct form the 8 different exercises for the prevention of back pain. So let us begin with the program here. So the first active learning lesson that we're going to have are going to be statistics, lecture, and giving feedback. The HGMI for this will be computer assisted instruction, which is verbal linguistic. Giving feedback will be interpersonal, and the objectives covered under this will be the cognitive number 1 and the affective objective. Now, in this particular setting with the lecture, I'll have a PowerPoint presentation along with the blackboard or a dry erase board probably, and talking about the causes of back pain and also the medical causes of back pain. The common causes of back pain are going to be improper lifting. At this point, I will ask the participants, has anybody experienced any back pain at work from improper lifting, or at home from improper lifting, and with a show of hands, and then also with the poor posture, sitting and standing. Of the participants, who has a standing job, which would be in the factory, and then who has an administrative job, which I assume would be secretarial, and with a show of hands showing how we'll be able to pinpoint exercises to help with the prevention of that type of back pain. Again, stress and tension. Who has stress in their workplace, who doesn't, and also by a show of hands talking about and having feedback on who can say or who can tell me any stress relieving type of measures that you do at home, whether it's a bubble bath, you drink a glass of wine, whatever, stress relieving tension. Poor muscle tone and lack of exercise. I would ask the question, who in here has a regular daily exercise routine or weekly exercise routine? And with a show of hands, and I assume probably would not be very many, that I would focus on some of the exercises and doing the exercises I'm about to show every day. Being overweight, and also too soft of a mattress or pillow when sleeping. All right, with that come the medical causes of back pain. I would ask, has anybody in the room ever been diagnosed with degenerative disc disease, spondylosis, scoliosis, sciatica, herniated disc, or stenosis? With a show of hands, anybody that has raised their hand. Degenerative disc disease is going to be the most common, and with that, everybody pretty much has that if you're over the age of 30 years old. And with this, any of the other ones between spondylosis and the herniated disc, some of these may be medically, if a physician has told you that you've had these or been diagnosed with these particular problems, maybe something to be looked into before doing these exercises. Also in that, I want to mention the high blood pressure. If anybody has high blood pressure that's not been treated, would also possibly be a contraindication for doing any type of strenuous exercises. So on this next one, the active learning here is also going to be the statistics as well as which is the logical and mathematical HGMI, and case studies, and guided observation, which is visual and spatial, which would also be from statistic graphs and also from a PowerPoint presentation as well as the board. Here we're going to talk about common statistics for men versus women versus back pain. And here about 35% of more women than men experience low back pain and neck pain than do men. So 35% more women than men experiencing that. Now, also we want to talk about in here, also in the program, we want to talk about the deconditioning syndrome of how we get from just, normal back to degeneration, then also regeneration on how we can improve our back. The first thing with deconditioning is how do we get to that point? Well, disuse. If you lose it, you don't use it, you lose it kind of thing. Disuse. Also impaired tissue nutrition, which will lead to accelerated degeneration, which will lead to chronic back pain. Now, the way to reverse that backwards is controlled activation with improved motor control, which is, again, exercise in a controlled fashion, no jerking, not doing it fast. Also increased muscle strength and endurance, and the restoration of structure and reduction of pain. Next is where we're going to come to our learning activity, which the next 8 slides are demonstration and physical activity. Physical exercise is going to be the HGMI, the HGMI will be body kinesthetic, and the method will be physical exercise. And the objective on the next 8 slides are going to be the cognitive number 3 and also our psychomotor. The first exercise is basically going to be partial crunches. Now, when I get to this point in the presentation, I will ask the student or the participants to stand up, move the chairs out of the way, get into a circle. They also have mats that will be provided, also with my assistant, who will be a personal trainer, and the assistant will hand out the mats to everybody. And then at this point in time, I'll ask anybody if they have any knee problems, any hip issues, any issues with getting up or down off the floor, which these particular exercises will have that. If I do have those situations, then those people would be excused from doing this program. I mean, not from the program, but from doing these exercises. The first one is going to be a partial crunch, and on the mat with their knees bent and their feet are going to be flat on the floor. They're going to tighten their stomach muscle groups, and they're going to raise their shoulders, just their shoulders off the floor. They're not going to be doing a complete sit-up. They're going to breathe out and exhale as their shoulders are coming off the floor, holding their lower back down. They're going to repeat about 8 to 12 times, and then they're going to keep with their feet and their tailbone and their lower back remaining on the floor at all times. Next one is going to be their hamstring stretches. This point in time, the assistant will hand out towels that will be provided for the participants to use in this particular stretch. And this is a towel stretch for the hamstring. And for this particular group, they're going to lie on the mat. The towel is going to be on the ball of their foot, and with a very controlled and slow motion movement with one leg down, they're going to pull that leg towards them, not to feel any tension, not for it to pull too much, and not for any pain. They're just going to feel it till it's tense. Hold it for about 30 seconds, lower the leg, raise the next one up. I will ask the room at this point in time any questions. Do they have any problems with this particular exercise? The point of this is not to go to where it hurts, but it's just to go to where they feel a little bit of tension to where they can feel the stretch. The next exercise is going to be wall sits. Again, another for a strong back, we need to have strong quads. Now with this, is going to be standing about 10 to 12 inches against the wall. They're going to lean back against the wall with their palms on the wall, slowly sliding down against the wall with their lower back pressed to the wall. They're going to come down, hold parallel where their hips are parallel to their knees. They're going to hold that count for about 10 seconds, and then they're going to slowly come on up. I want them to do this about 10 times. Kind of like a squat, but basically it's just a wall sit. They're going to sit there, hold it, and then come up and then do it about 10 times. Okay. The next exercise are going to be press-up extensions. With this particular exercise, they're going to be laying on the floor. Again, I would ask the participants in the room if they have any problems laying on their stomach. Some patients obviously would. And in that particular instance, I would have them just sit. On here with the press-up extensions, they're laying on the ground. Their forearms are underneath their shoulders, and then they're going to go from their forearms up to their hands and then leaning back only to where the bend is made in just above their pelvis. By doing this, they're going to hold that stretch probably for a count, I'm going to say of about 10 seconds, and then down again. And they're going to do that about 10 times. Okay. The next exercise is going to be the bird dog. Again, just kind of looks just like it sounds, just like what the word is. With the bird dog, they're going to be on their hands and knees. They're going to lift and extend their arm, say their right arm out, and then their left leg will be out. So they're going to do opposite arm to opposite leg, their head tilted down, kind of in a straight motion there. They're going to keep their hips level, and they'll do that about 8 to 12 times on each leg. Now, again, at this point in time, I will go around the room making sure that everybody has the correct form, is in the correct pattern, nobody is hurting themselves. Anybody has any questions about if they're doing it right, and just make sure the form is correct. After the bird dog, we're going to do knees to chest. This has two components. It has a normal one that also has an advanced level. With the knees to chest, the participants are going to lie on their back with their knees bent, or their feet on the floor. They're going to take one leg, pull it up to their chest, with their lower back pressing against the floor. They're going to hold that for about 15 to 30 seconds. In this case, with the amount of people in the room, about 15 seconds. And then they'll do it about 2 or 3 times, and then they'll go to the next leg. The advanced movement on that is what I call a double knee lift, or double knees to chest. And the same thing with their feet starting on the ground, but this time pulling both knees up to their hips, or both knees up to their chest, holding it for a count of 15 seconds, and then releasing it. Again, going around the room, seeing who can do the double knee lift and who can do the single knee lift. The next one is going to be our pelvic tilt. The pelvic tilt, it looks super, super simple, and it's just a great exercise for the lower back and for the core. The participants are going to lay on their back with their knees bent and they're flat on the floor, and they're going to tighten their stomach muscles, just really exhale and tighten their muscle groups, contracting it, and then they're going to feel their back pressing to the floor. So feeling their back pressing to the floor with their hips and their pelvis, kind of rocking back and forth as they lean, as they press their back into the floor. Holding for about 10 seconds, doing it about 5 times. Again, going around the room, checking to making sure that everybody's doing it in a controlled fashion, and holding it for the proper count, because it's not a fast movement, it's a very slow movement. Okay, the next exercise, and about the last exercise, is what we call bridging. And this is kind of cool. It's also a good hamstring move too. But bridging, they're going to lie on their backs. Their knees are going to be bent, and just their heels are going to be on the floor. And they're going to push with their heels off of the floor. With their hips and their butt are going to come off of the floor until their shoulders, hips, and knees are straight in alignment there. This kind of shows them as they're moving up, but all of this will be straight. And by doing that, they're going to hold it for about 6 seconds. Then they're going to lower their hips down to the floor, and then they're going to come back up again. They're going to repeat that about 8 to 12 times. That's going to end the 8 exercises that we have. The questions that I would go around the room are, why is it important to have proper form and technique? Also, why do we not want to do sit-ups? Full sit-ups in this, and why do we not want to do leg lifts? The reason we don't want to do sit-ups and leg lifts, and I probably anticipate some of these correct answers, would basically be because with doing sit-ups, we're really putting too much pressure on our lower back. It's the same with doing leg lifts. That's putting way too much pressure on the lower spine, on the lower back, and just not doing it correctly. Too many people do it too fast, too slow. This actually concludes the presentation. I would ask if anybody has any questions. If anybody cannot do these exercises properly, I would take them aside and show them some other exercises. If anybody has any medical conditions that need to be addressed, I would ask them to please have them checked with their local family doctor before they continue doing any of these exercises at home. And I thank you for your time.